Sports injuries are common among athletes, but did you know young women are 4 times more likely to have a knee injury versus their male counterparts in the same sports? Whether it's darting back and forth down the football field or a quick turn on the basketball court, the knee plays a big part in the player's agility. Here's a brother-sister combo to share their story of how orthopedic surgeon Peter Simonian helped the pair when injuries left them both in need of surgery.
Is Riley leaving right now?
Teenage siblings Riley and Wilson Ashford never planned on having surgery together.
Hey, Riley.
Wilson's yelling goodbye.
Bye.
This is Sister Riley's 4th surgery and younger brother Wilson's 1st.
I retore my ACL and had to have knee surgery again.
While Riley is a top athlete, injuries have plagued her high school athletic career.
Her name's up on the wall still, and she has the records, and we just always thought this girl's going to go on to college and play a sport. That's just how she's wired. And when she continued to have setbacks every year and never really get out of rehab, we're still going through the whole acceptance process of that.
Research shows Riley's gender might be one of the factors for her knee injuries, says orthopedic surgeon Dr. Peter Simonian, who reconstructed her ACL.
What we do know is that young women tend to have ACL tears about 4 times as common as their male counterparts in similar sports. People are really looking at preventative measures, especially for young women playing sports, whether at the high school or collegiate level, where this is becoming a little bit of an epidemic problem and can be a career-ending injury for some.
So I never really thought that I would get injured this much.
How long is the surgery?
Neither did brother Wilson, who during kickoff at his football game was surprised at how fast his injury happened.
And I made a quick cut to go right, and my knee just gave out and I just fell down on the ground. Yeah, I was out, yeah. Had surgery towards the end of the season, end of the season, and I was out from there.
Dr. Simonian explains what this type of injury means to an athlete.
It's a surgery that is very devastating for the person who has it because they're typically out for a year or a season. It's a long recovery, it's a long rehabilitation.
Dr. Simonian reconstructed and repaired the siblings' injuries with the help of his team at Clovis Community Medical Center.
With ACL reconstruction, the key to a good result is having precise placement of the tunnels, because you want to have this new graft in place as anatomic as possible, as close to what God gave these patients. We had to trim that segment of meniscus out. And we can't do it perfect because of the nature of the native ACL. It twists and turns, and we're trying to recreate this with a single band of tissue. This is the new ligament in place. So that looks really good. But we come pretty close, and these knees do remarkably well. But again, it requires precise placement, and by doing these arthroscopically, it really does give us an advantage of putting things within millimeters. What we do, and we think that the rehabilitation is significantly less because we can do it in this more minimally invasive fashion. But it does help with the recovery significantly to minimize the approach to the knee and minimize the trauma.
Both of you are doing very, very well.
Riley and Wilson did their rehab at Thrive Physical Therapy after surgery.
Oh yeah, my knee is going to be fine. It already feels good.
Physical therapist Curtis Cookingham says their recovery went fast.
Is she was able to get back literally all her motion right off the bat.
But it will always be a little bit different than my other knee.
Parents Wendy and Greg think Wilson and especially Riley are stronger after their ordeal.
And that's one of the things we talk about is the fact that sports teaches you about life.
And the trial will make you stronger. She'll be stronger for it. Definitely.
Like I said, this trauma has made our family closer in so many ways.
Well, at times it's really hard to, especially during my senior season, to sit and watch my teammates play, thinking, wow, like, that could be me, But I would say it has made me stronger. Just, as a person, I've learned to overcome things and move on.
I think they're great, and their attitude is great, and their parents are wonderful and supportive people. I think that's going to make a huge difference in their recovery and their rehabilitation.
While Wilson should be back for football, Riley's out for her last year with Buchanan's girls basketball, but she's not down.
So I'll definitely be at the games, cheering them on.
Definitely a family that plays and heals together. Good luck to you both. For more information on this type of procedure, go to medwatchtoday.com.